All right, in this recording, we're going to look at a few muscles of our leg. So the leg is really the region from the knee down to the wrist, so or to the ankle. So in between our knee and our ankle, this is where we have our leg. So we're going to look at three main muscles here, all right? The first one is going to be one known as the tibialis anterior, okay? So just based on the name, tibialis anterior, we have the tibia, right? So we have our tibia here, and we have the anterior surface. So find the muscle that's near the anterior surface of the tibia, and you should find this muscle here, all right? So if there's a tibialis anterior, there's probably also a tibialis posterior, and there is, okay? But that's in the posterior compartment of the leg. So this tibialis anterior, now in this leg compartment, in this leg region, there are lots of muscles, and we're only gonna look at a few in this recording, okay? So our tibialis anterior runs in this anterior compartment here. It attaches down here to the base of our first metatarsal. So if we look right here, we can find our first metatarsal, and then here's that tendon. Here it is highlighted of our tibialis anterior. So it attaches there, and when this muscle contracts, it produces dorsiflexion. So remember, dorsiflexion is the pointing of the toes toward the sky. You are bringing them closer to the dorsum of your foot, which is the top of your foot that we typically think of. So if you had shoes off and you were looking down onto your feet, the part of the foot that you would see would be the dorsum of your foot, all right? So that is the tibialis anterior. Whenever you point your toes up, you can feel this muscle contracting right at the anterior surface of your tibia, all right? So if we flip this around, we can see more muscles, and we'll look at two in particular. One is the gastrocnemius, and then the soleus. So the gastrocnemius is this muscle right here, all right? The gastrocnemius is typically what we think of as our calf muscle, and this is a plantar flexor of the foot, so at the ankle. So if you recall, dorsiflexion was pointing our toes up, so plantar flexion is pointing our toes down toward the ground, toward the plantar surface of the foot, okay? So the sole of the foot, the underside. This muscle also happens to cross the knee joint proximally, as you see right here, and so this this allows it to act on the knee, and so it's going to flex the knee as well. So it is a plantar flexor of the foot, but at the same time, it is also a flexor of the knee. Now, deep to the gastrocnemius, we have one called the soleus, and we can see this one right here, highlighted in blue. This one does not cross the knee, but it does come down and attach to our calcaneus, just like our gastrocnemius does, and we'll talk about this tendon here in a second. But this soleus comes down, attaches to the heel, attaches to our calcaneus. This is our calcaneus right here. And as it attaches there, it serves to also plantar flex the foot, so it causes us to point our toes downward. So we said earlier that the gastrocnemius is a dorsiflexor of the, is a plantar flexor of the foot. So here's that gastrocnemius again. It attaches to our calcaneus, which is this bone distally, by this large tendon known as the calcaneal tendon, right? So the calcaneal tendon is what we typically think of as the Achilles tendon, all right? So this is a very, very large tendon. You can feel this in the posterior aspect of your leg, so in your posterior leg compartment. And this is the extremely thick tendon that serves to attach our gastrocnemius, or our calf muscle, down to our calcaneus. And when the muscle contracts, when gastrocnemius contracts, it pulls on the calcaneal tendon, that pulls on the calcaneus, and that points our toe downward, right? So this produces plantar flexion, okay? So there's lots more muscles in this area, but we're only gonna look at these three. Now, I need to make a note about the last video. So if you've watched the video yet about the thigh region, so we talked about these thigh muscles up here, so we talked about the hamstrings, we talked about the quads, and we talked about the adductor muscles. I mentioned, accidentally, I'm not sure what I was thinking. I said that these hamstring muscles only flex the knee, that they don't do anything to the hip. That is not true. They do move the hip as well. So these muscles are going to flex the knee, but they're also going to come up here. They're going to attach to the ischial tuberosity of our os coxa, and when that happens, they're going to serve to extend the hip. So if we look at this animation here, if we look at this animation right here, this is hip extension, okay? So we are extending the hip posteriorly, right? So we have our gluteus maximus accomplishing this. We have our adductor magnus, and then we have our three hamstring muscles, right? So we have semitendinosus, highlighted in blue there. We have semimembranosus, and we also have biceps femoris, okay? Remember, the biceps femoris, for this one, it's only the long head, all right? but I inadvertently or accidentally said that they do not move the hip, but they do in fact extend the hip. They produce this hip extension as the hip is going posteriorly. Okay, but also recall they also move the knee at the same time. Okay, so I just wanted to clarify that if you were confused about that one video, or if you haven't watched that video, just be aware I do mention that those muscles do not move the hip, but they do in fact move the hip. They produce hip extension. Okay, all right. Thank you.